The study analyzed how the U.S. stacked up against countries such as Australia, Canada, France, Germany, Japan, the Netherlands, New Zealand, Norway, South Korea, Sweden, Switzerland, and the UK. Its healthcare spending is almost 3 to 4 times greater than that of South Korea, New Zealand, and Japan. Despite its higher spending, the US doesn't necessarily achieve superior healthcare results compared to other countries. So why are US healthcare costs rising more than anywhere else, and can it be stopped? Hey everyone, welcome back to our channel. In today's video, we are going to examine why US healthcare is expensive. The US healthcare industry is among the most expansive and intricate, making up 18% of the nation's GDP in 2020. The increasing age of the US populace, coupled with the baby boomer generation nearing seniority, ensures sustained high demand within the healthcare domain. Over half of Americans have reported foregoing or postponing medical treatments due to financial constraints. Even insured individuals have faced monetary challenges. The World Health Organization, WHO, suggests that all-encompassing coverage could curb excessive health expenditures. The absence of such widespread coverage not only escalates costs, but can also result in inferior healthcare outcomes, particularly in preventive care. Let's examine a few of the factors that contribute to the expensive healthcare in the USA. Factors contribute to the high cost of healthcare in the USA. Insurance. A large segment of the US population relies on private health insurance for their medical needs. Most Americans find themselves with limited options regarding their health insurance. Over half, specifically 54%, obtain health coverage via their employers. Some benefit from extensive and reasonably priced health insurance, while others are left with inadequate or no coverage. Complex USA healthcare system. A primary factor driving the elevated healthcare spending is the disjointed structure of the US healthcare system. It is intricate, with distinct regulations, funding sources, enrollment periods, and associated costs for different insurance types from employers, private entities, or government-backed programs like Medicaid and Medicare. For healthcare professionals, this translates to navigating a maze of rules related to service provision, coding, and invoicing. Such administrative tasks constitute a significant portion of the overall operational expenses. Which brings us to the next point: high administrative and varying healthcare cost. Often, administrative expenses are highlighted as a significant factor in increased medical outlays. Hospital-related expenses constitute 31% of the country's healthcare costs. A July 2022 report by the Healthcare Cost Institute highlighted that the US incurs higher healthcare costs compared to other advanced countries, with a portion of these expenses attributed to system administration. Despite these costs, the US healthcare outcomes aren't necessarily superior. Cost shifting. The healthcare sector doesn't operate as a true free market. Instead, insurance companies negotiate on behalf of their clients. This limitation is worse for patients, who are often unaware of the actual costs of services. Much of the healthcare provided operates on a fee-for-service basis, meaning doctors charge for every service they offer. The propensity for litigation in America can also contribute to unnecessary medical tests. Without genuine free market competition, insurance providers often attempt to control costs by either rejecting claims or mandating prior approvals. Higher salaries for medical professionals. As stated earlier, Americans tend to visit doctors less frequently compared to other developed nations. This trend might be linked to the US having fewer practicing physicians, as indicated in the report. In 2022, US healthcare professionals commanded higher salaries compared to their peers in other developed nations. USA aging population. The proportion of the US population aged 65 and above has seen a notable rise in recent years, growing from 13% in 2010 to 16% in 2021. This trend is anticipated to continue, with projections suggesting it will reach 20% by 2030. Given that individuals in this age bracket typically have higher healthcare expenditures than other age groups, the growing senior population will likely escalate overall healthcare costs. Additionally, as more people reach the age of 65, they qualify for Medicare. This surge in enrollment will inevitably amplify Medicare's expenses in the long run. Why increasing healthcare costs matter. Soaring healthcare costs intensify the current fiscal challenges, acting as a primary factor in the persistent gap between the country's spending and revenue. In the US, the prevalent belief is that individuals should approach healthcare as they would to any consumer product. However, this model falls short in healthcare, where emergencies and emotional decisions often strip individuals of their bargaining power. The irony of U.S. healthcare is its staggering cost, which paradoxically makes cost-saving reforms challenging. The vast wealth of the healthcare industry translates into significant political influence, complicating efforts to reduce prices. However, there's a potential middle ground. Bernie Sanders' Medicare for All proposal offers a transitional plan that broadens Medicare's scope and accessibility. While not a panacea, it's a step towards recognizing that government-led healthcare can often be more efficient and cost-effective than its private counterpart. While it remains unclear when and how the surge in U.S. healthcare costs will decrease, one wonders what steps the U.S. government can take to make healthcare more affordable. In most developed nations, the government plays a pivotal role in regulating healthcare costs, thereby avoiding the steep administrative costs that characterize the U.S. system. However, the absence of substantial political backing in the U.S. prevents the government from taking a firm hand in controlling healthcare expenditures, a factor that contributes to the soaring prices. Given the current circumstances, it doesn't seem like the situation will change in the near future. What do you think? Will USA healthcare ever be affordable? Let us know your thoughts in the comment section below.